often people with depression, stress, anxiety will think that they're having a heart problem because they have just a feeling of heaviness in the heart, especially in certain situations. You know, sometimes, for example, people's anxiety might be related to work.
Mm-hmm.
And they will find that in the morning when they're preparing to go to work, their chest just feels heavy and they think that they're having a heart problem. When you really go into it, it might be that you're just anxious or you're just feeling down about your environment. So definite physical symptoms. And we have seen, of course, there are extremes in everything. We have seen patients who come in with mysterious conditions and, after speaking and, building up a relationship and talking, and you will find that it is related to some stress or some previous problem that they're facing that they're not able to handle, and it is causing them to have physical symptoms. So it does go both ways. Depression can cause you to have physical symptoms, but as I mentioned with diabetes and blood pressure, one of the biggest risk factors for stress is having a medical problem as well.
Yes.
So especially people with chronic problems, something that just doesn't go away, like diabetes, blood pressure, if you had a stroke, if you have it's helpful always to consider as a doctor and as a friend, I suppose, asking the person how you're doing, how you're coping, how you're managing with this, with the diagnosis, with managing the condition itself.
And chronic pain too must be something that must be extremely, you got to be depressed if you're calm.
Right. Yeah. So chronic pain, and I assume you're talking about chronic pain syndromes that people have.
Yeah.
There are certain people who have chronic pain because they have a medical problem.
Right.
For example, if you have, God forbid, cancer, for example, that spread to bones, that's one of the more painful conditions.
Right.
So if you have a chronic medical pain condition like that, that does lead to depression. And as you say, it's quite reasonable that if you have chronic pain, that you would have a higher risk of depression as a result.
So getting back to men and Caribbean, is there one particular condition that men in the Caribbean are more, prevalent to have a more, in terms of mental health? Is there one particular area or
of mental health problems?
Yeah.
I think worldwide, anxiety and depression are the more common mental health conditions that we face. Anxiety probably be number one, and depression number one, and anxiety number two. There are others as well with men. Post-traumatic stress is common in places with violence, especially men involved in physical violence. Post-traumatic stress can occur. Schizophrenia is also frequent. Obsessive compulsive disorders. I'm not a psychiatrist, so I don't think I want to go into detail about what those things mean.
Yeah.
But those are the common thing. And I would like to mention as well with young men in particular. I hope I don't get in trouble in the Caribbean for mentioning it, but I always mention it, especially if young men who come to see me. There's a risk for increased mental health conditions with excessive marijuana smoking. I know culturally we do have, from birth, I've been told by the radio and reggae music that, it's good to, have a little once in a while. But realistically speaking, it does increase the risk of certain mental health problems in young men. So I always like to bring that up to young men who might be exposed to marijuana use, that is a risk that you take when you do that.
Because their brains aren't formed and they're still forming.
Absolutely.
Yeah. So there's a reason.
You're right. You're right.
You're not just trying to make them feel bad.
I'm not trying to make them feel bad, and I'm not trying to destroy the culture, but it is a risk, and we do recognize that people who use excessive amounts of marijuana, there's a syndrome. They call it demotivational syndrome. I think psychiatrists. Yeah, you become apathetic. You don't have any motivation. You don't have any drive. So they tend to not want to pursue any goals. And that is something that is recognized as as one of the risks with excessive marijuana smoking. And that's the last thing you want in a young man, especially in our culture, in the financial climate, and, not being able to get a job, and, you don't want to lack motivation as well. So I always make sure that I mention that to people who are marijuana users.
Okay.
I hope I don't get phone calls.
You will. I was going to say something, but I think I will hold my tongue tonight. Have you found that Caribbean men in particular face challenges which can lead to mental health issues? If so, give some examples.
Well, one of the more common things we mentioned already is the stigma. The fact that you have to be thought of as macho all the time. Mm-hmm. That is an intense pressure on a young man who may have, if you face issues in your young life and you're growing up and you would like to have those issues resolved, but you can't because, you have to be tough. You have to be a tough guy. You have to man up, those
man up.
Yes, you have to. That's what people tell you to do. Yeah. So that is one of the things that we find in the Caribbean is a risk factor to mental health issues. But also the Caribbean, generally speaking, is considered a more medium to low income region, and we do know that financial stress and social, deprivation, people who don't have enough tend to have a higher risk of mental health issues as well. So maybe not Cayman, because we're not. I'm not an economist. So I don't know where Cayman falls on the scale in terms of social and financial economic success. But the rest of the Caribbean, I know, the poorer countries, that financial stress is a risk for mental health issues as well. And I suppose even if Cayman might be less economically deprived, but we do have lots of people in Cayman who do have financial troubles. So there are people who struggle to make enough money to feed their family or to support themselves. And that is a risk for stress and mental health problems as well. And also, I suppose I imagine you would probably bring this up, but COVID, everybody, right now, for the last year plus, that is a major stress, a major risk factor to everybody's stress levels, and it has caused an increased number. I did ask the psychiatrist this in particular. We do find that there are more people now with mental health issues, with stress, with anxiety, depression, people with suicidal thoughts of harming themselves because of the COVID pandemic, both in young and old people as well. So,
I can imagine. I mean, our way of life has changed drastically last year. We seem to have gotten some normalcy back, but I mean, the fact that we can't jump on a plane.
Right. And for some people, normalcy hasn't returned yet. I mean, this week I just spoke to somebody who used to work at a restaurant.
Yes.
A restaurant that is majorly funded by tourist income. And restaurants had to close down, so this person's been unemployed for a year now. Yeah. No work. So.
Oh my gosh, that must be.
Yeah. So some of us have done well, to maintain, our lifestyles, livelihoods, but there are quite a few people who have lost some of their or all of their income. So there's a lot of stress going on with COVID still.
So what? I want to do it's going to kind of interrupt the flow of the interview, but your segue kind of is going to lead into me in my segue. The fact that people are without jobs, especially in that tourist related industry, and we are a couple of months. I don't know how long we are to reopen, because I really don't know. But what would you say to people who are sitting on the fence about the vaccine?
I would say that it's a bit encouraging. I don't know if you noticed in the paper recently or in the reports from the Public Health Department. I think the last week or probably the last few days, the numbers have increased. We were hovering around 50%.
Nice.
But somehow we've jumped to 60% in the last week of people who have had at least the first shot. So what I would say to everyone is that I think people are recognizing the importance of getting vaccinated, and it seems that people are starting to come again. The vaccine has been around for a significant length of time now. It's been 6 months since we've had the vaccine. We have enough experience with it now so that everyone can, or most people can recognize that it is safe. The side effects that you would expect after the vaccine are, although you might feel bad for a few days, but the side effects are temporary, and vast majority of people recover completely. And the peace of mind that, if you read the reports that people describe how they feel after they've had their shot, the peace of mind that you get would go far in easing your anxiety and the stress that we're having from COVID, knowing that you've finally been vaccinated and that your risk of contracting the disease is significantly reduced, up to 95%. Some studies are suggesting. So I would encourage everyone. The vaccine has been around for a significant length of time. We know that it seems very likely that it is safe, and it is definitely effective. And for the sake not just of yourself, but your family and your community, I would encourage everybody to go out and get the vaccine. Yeah.
Thank you so much. Well said. We only have 4 minutes left, so we're gonna the last two questions. One is, what ongoing treatment is available to men who want psychological help?
Right. So when you come if you were to see me as a doctor, for example, in terms of support, we talk to you as a doctor. We can try some simple techniques to have you recognize. The first step usually is getting most people to recognize that they do have problems, or they do need help, especially men. Like I said, if you came for your pressure and I bring it up, some people give a lot of resistance to accept that they need help with their stress. The first step is accepting, okay, I need some help. And then we can talk through different strategies that you can use. Exercise regularly, have a good diet, encourage or push yourself to associate with more people who can help you to feel better about yourself. Cut down on drugs and alcohol if you use too much of that. And in terms of actual treatment, medical treatment, we do have counseling and we have medication available. In terms of counseling, there are quite a few services in Cayman. I usually refer lots of people, to the Government Counseling Center. I should have brought the phone number. It's a free service offered by the government. You phone in and you walk in, and they have up to 8 or 9 qualified psychologists who are very good at their job. I get very good reviews. And on top of that, we have other services as well. Lots of private counseling services. Also the EAP, the Employee Assistance Program, has counseling services. The hospital, all 3 of the hospitals are available here, also have psychiatrists. There are quite a few psychiatrists at the HSA, and the psychiatrists are able to help you with medication as well as counseling to try and reduce your anxiety or your depression symptoms. So there are quite a few available services here for mental health problems. So yes, the Government Counseling Center, phone number 949-8789, and it's a walk-in service, very good service. Just last week, one patient was telling me how very happy she was that her daughter accessed the service. They're very good. I cannot I wouldn't hesitate to recommend them. So you can walk in 949-8789 if you have any stress, anxiety, depression, you think you need help. Just call that number and they can help you. Or you can come by the hospital and we can refer you to any of the other services. Private services are available as well if you have the insurance or you're willing to pay for it out of your own pocket. So and in terms of medication, there are lots of medications that can help. We tend to put people on, very often patients are concerned about side effects of medication. The medications that we start you off if you need some help just to get out of that dark hole that we talk about tend to be the ones that have the lowest risk of side effects. Those are the ones that we would prescribe as GPs. And we would refer you on to the psychiatrist if you need any stronger medication. So most people that we put on medication don't tend to have much problems in terms of side effects with medication. So in other words, yes, you can come to us and you can get help if you do have a mental health problem. There are lots and lots of services that we can offer. And the first step, like I said, is just accepting that you need to speak to somebody and coming to speak to us. And we can help you.
Well, thank you so much for being on For the Health of It, Dr. Schilling-Ford.
Well done.
And we, thank you again for sharing about mental health and so that men can put the stigma, men and women, because one thing COVID has taught us is everybody gets it.
Everybody, yes.
It doesn't. Everybody gets a little brush of it. So, thank you so much for being on For the Health of It. We are moving you to the life you want.
Refilling and transferring your prescriptions have never been this easy. Simply go to healthcarepharmacy.ky and follow the easy directions from your desktop, mobile device, or tablet. All you need to do is pop into Healthcare Pharmacy in Grand Harbor to collect your prescription. They're open 8 a.m. to 10 p.m. Monday through Saturday and 10 till 6 on Sundays and public holidays. No waiting in line, no wasting your lunch hour, no stress. Just easy online prescription refills and transfers from the pharmacy that has been caring about your health for 25 years. Call 947-8900 to speak to a pharmacist or go to healthcarepharmacy.ky and make life easy.
When you need a bleach to make your scene clean, get Chlorado Bleach. For the ultimate white and the ultimate clean, Chlorado Clean is always seen.
The ultimate clean is a Chlorado Clean.
The Cayman Islands Civil Service Association, CICSA, is an association that brings all government employees together at the workplace, social events, and in matters of concern common to all civil servants. For more information on how you can become a member or to read our story, visit us on www.cicsa.ky or on facebook.com/cicsa.ky. CICSA, connecting, informing, and engaging our membership.
For the Health of It, Radio Cayman's premier health show is brought to you by
Healthcare Pharmacy, caring about your health for the past 25 years.
the Cayman Islands Civil Service Association.
Chlorado Bleach. Mildew, no problem. Stains, no problem. Whites, no problem. Sanitary cleaning, no problem. Chlorado Bleach has got you covered. Available at Foster's Food Fair in 2 liters and 1 gallon sizes. Pick up a bottle today.
And Evangelist Joseph Ebanks. Have you heard the call?
This is For the Health of It with Tara Bush. For the Health of It with Tara Bush.
Radio Cayman,
The voice,
the heart, the soul of the Cayman Islands.
I've tried the short roads to being a man. Beautiful, beautiful shoreline.
Oh, Cayman moon.
Cayman all-time favorites.
Poor old Robert, Poor old Robert.
Here he comes, Osito, come to spray mosquito. All the girls in line, they say, Louis, please spray mine.
K-Man all-time favorites begins right now.
I used to work in Georgetown in a department store. I thought that I did a very good job, but I don't work there no more. A lady came in for a hat one day. I asked her what kind she wore. Felt, she said, so that's what I did. Now I don't work there no more. Then I got work in Freeport in a shoe store. I thought I did a wonderful job, but I don't work there no more. A lady came in for some shoes one day. I asked her what kind she wore. Rubber, she said, that's what I did. Now I don't work there no more. Then I got a job in Barbados in a bakery store. I thought that I did an excellent job, but I don't work there no more. A lady came in for a cake one day. I asked her what kind at the door. Later she said, so that's what I did. I don't work there no more. They got no sense of humor. So I got a job in Nassau in a clothing store. I thought I did a fantastic job, but I don't work there no more. A lady came in for a dress one day. I asked her what kind she wore. Jumper, she said, so that's what I did. Now I don't work there no more. So I found me a job in St. Thomas. Oh, I like that job a lot. I was a bartender at this hot night spot. A lady came in for a drink one day. I asked her what kind she want. Liquor, she said, so that's what I did. I got fired right there on the spot. I used to work in Georgetown in a department store. I thought I did a wonderful job.
Sweet nutmeg, cinnamon, baking powder, vanilla, cornmeal, salt and flour. Lots of cornbread sweet, not as sweet as me. Lots of cornbread sweet, not as sweet as me. Coconut milk, butter, brown sugar, put them together and mix them good now. Lots of cornbread sweet, not as sweet as me. Lots of cornbread sweet, not as sweet as me. Sweet. When I finish baking up cornmeal on the bottom, custard on top. Lots of cornbread sweet, not as sweet as me. Lots of cornbread sweet, not as sweet as me. Sweet. Cornbread down on Water Street, soon be done, then we got eat. Lots of cornbread sweet, not as sweet as me. Lots of cornbread sweet, not as sweet as me. Nutmeg, cinnamon, baking powder, vanilla, cornmeal, salt and flour. Lots of cornbread sweet, not as sweet as me. Lots of cornbread sweet, not as sweet as me. Sweet. sweet, but not as sweet as me. Pass it up, cornbread sweet.
Girl, you are my princess, you are one of a kind. Night and day, I say you blow my mind. Girl, you are my princess, you are one of a kind. Night and day, I say you blow my mind. When you're walking down the street, oh little girl, I say you look so sweet. And every day that you pass down the lane, all the men they want to know your name. When a man got a girl like you, it's like his greatest dream come true. Girl, you are my princess, you are one of a kind. Night and day, I say you blow my mind. Girl, you are my princess, you are one of a kind. Every night and day, I say you blow my mind. My friends, they all said to me, oh Skanky, you're so very lucky. Tell me what a man needs to do to find a girl as sweet as you. In you, girl, I see everything. That's why I ask you to wear my ring. Girl, you are my princess, you are one of a kind. Night and day, I say you blow my mind. Girl, you are my princess, you are one of a kind. Every night and day, I say you blow my mind. When you're walking down the street, oh little girl, I say you look so sweet. And every day that you pass down the lane, all the men they want to know your name. When a man got a girl like you, it's like his greatest dreams come true. Girl, you are my princess, you are one of a kind. Night and day, I say you blow my mind. Girl, you are my princess, you are one of a kind. Every night and day, I say you blow my mind. My friends, they all say to me, oh boy, you're so very lucky. Tell me what a man needs to do to find a girl as sweet as you. In you, girl, I see everything. That's why I ask you to wear my ring. Girl, you are my princess, you are one of a kind. Night and day, I say you blow my mind. Girl, you are my princess, you are one of a kind. Every night and day, I say you blow my mind. Girl, you are my princess, you are one of a kind. Night and day, I say you blow my mind. Girl, you are my princess, you are one of a kind. Every night and day, I say you blow my mind.
Jah love, you know it sure. He'll make all your dreams come true. Just be careful what you do. It's Jah love I'm depending on to guide me out this night shift. When you work on the night shift, ain't nobody this, no. Night, I can't work no night shift. Night, we not working with no forklift, nah. Oh, no, night shift. Night, I can't work this night shift. Night, we not working with no forklift. Night, I can't take this night shift. Night, you get the fright on your gun, boy. Night shift.
Work Jobs Cayman has a new look. Registered users can now experience a more user-friendly platform, allowing for easier registration and posting of job ads. To see and experience the new look today, visit www.work.ky. That's WORC.ky.
Radio Cayman.
The voice.
The heart.
The soul of the Cayman Islands.
45 years young. Happy anniversary, Radio Cayman.
Went to a place the other day, they could not dance the Montera. People gathering around me, they want to see it done. Music from the bandstand was coming nice and strong. So I left the band, got on the sun, I rode them on the song. Wind the wheels, that's Montera. Take off the place, that's Montera. Raise your hands, that's Montera. Go on like your mother, that's Montera. Wind the wheels, that's Montera. Take off the place, that's Montera. Raise your hands, that's Montera. Go on like your mother, that's Montera. When the music's done, they shot for more. I was warming up, don't you know? They learned to punta so quick. The old man put on his walking stick. Night came with lighted lamp. Who ran paper out to fight? It was going to be. A man never knew they could do it right. Wind the wheels, that's Montera. Shake off the place, that's Montera. Raise your hands, that's Montera. Go on like a man, that's Montera. Wind the wheels, that's Montera. Shake off the place, that's Montera. Raise your hands, that's Montera. Go on like a man, that's Montera. When the music done, the shot for more. I was warming up, don't you know? They learned to punta so quick. The old man put down his walking stick. Night came with lighted lamp. Who don't drink for also bike? It was going to be. A man never knew they could do it right. Wind your waist, that's Montera. Shake up the place, that's Montera. Raise your hands, that's Montera. Go on like your mother, that's Montera. Wind your waist, that's Montera. Shake up the place, that's Montera. Raise your hands, that's Montera. Go on soy un hombre sincero. De donde crece la palma y antes de morir me quiero echar mis versos del alma. Guantanamera, Guajira, Guantanamera, Guantanamera, Guajira, Guantanamera. Los pobres de la tierra, pido yo mi suerte hecha. Con los pobres de la tierra, quiero yo mi suerte hecha. El arroyo en la sierra me complace más que el mar. Guantanamera, Guajira, Guantanamera, Guantanamera, Guajira, Guantanamera. I am a simple man from the land of the palm trees, and I have a deep and sincere love for the earth, the skies, the seas, and for all creation. And before I die, I hope to see the lady of Guantanamera. Guantanamera, Guajira, Guantanamera, Guantanamera, Guajira, Guantanamera, Guantanamera, Guajira, Guantanamera, Guantanamera, Guajira, Guantanamera.
I'm used to my sunshine
Radio Cayman 89.9 FM.
and living free.
In the Cayman Islands.
He's quick with his smile, he has his own style. Still we call him Slow Key. He's never high strung, he'd never hurt anyone. He's always low key. Whenever we meet, for me is a treat. He'll never say, how are you? But here's how he'll say, in his own way, how do you do? You got any money? No drop on snow penny. Or could you buy me one beer to cool me from this hot sun? You got any money that you could lend me? Just a little will do to get me through this dry run. In this day and time, a dollar ain't worth what 9 pence was worth in 52. So I give him a 5 and to my surprise, he said, gee, $5, but I'm lucky too. You got any money? A drop on snow penny. Could you buy me one beer to cool me from this hot sun? You got any money that you could lend me? Just a little will do to get me through this dry run.
Toledo, across from the depot, on a bar stool she took off a ring. I thought I'd get closer, so I walked on over, sat down and asked her her name. When the drinks finally hit her, she said, I'm no quitter, but I finally quit living on dreams. I'm hungry for laughter and herever after. I'm after whatever the other life dreams. In the mirror I saw him and I closely watched him. Thought I really looked out of place. He came to the woman, sat there beside me, had a strange look on his face. Big hands were calloused, he looked like a mountain. For a minute I thought I was dead. But he started shaking, the big heart was breaking. He turned to the woman and said, you picked a fine time to leave me, Lucille, with 4 hungry children and a crop in the field. I've had some bad times, lived through some sad times. This time your hurting won't heal. You picked a fine time to leave me, Lucille. After he left us, I ordered more whiskey. I thought I'd made him look small. From the lights of the barroom to rented hotel rooms, walked without talking at all. She was a beauty when she came to me. She must have thought I'd lost my mind. I couldn't hold her, for the words that he told her kept coming back time after time. He picked a fine time to leave me, Lucille,